Dear friends, welcome to our channel. Today we are going to talk about type 2 diabetes. What is type 2 diabetes? Type 2 diabetes, the most common type of diabetes, is a disease that occurs when blood glucose levels, also called blood sugar, are too high. Blood glucose is the main source of energy and comes mainly from the food you eat. Insulin, a hormone produced by the pancreas, helps glucose get into your cells and be used for energy. In type 2 diabetes, your body does not produce enough insulin or use it properly. Too much glucose stays in the blood and doesn't reach your cells enough. The good news is that you can take steps to prevent or delay the development of type 2 diabetes. Who is more likely to get type 2 diabetes? Type 2 diabetes can develop at any age, even in childhood. However, type 2 diabetes is most common in middle-aged and older adults. You have a greater chance of getting type 2 diabetes if you are 45 years old or older, have a family history of diabetes, and are overweight or obese. Diabetes is more common in African Americans, Hispanics, American Indians, Asian Americans, or Pacific Islanders. Lack of physical activity and certain health problems, such as high blood pressure, affect your chances of developing type 2 diabetes. You are also more likely to get type 2 diabetes if you have prediabetes or gestational diabetes during pregnancy. What are the symptoms of diabetes? Symptoms of diabetes include increased thirst and urination, increased hunger, feeling tired, blurred vision, numbness or tingling in the legs or arms, sores that won't heal, and unexplained weight loss. Symptoms of type 2 diabetes often develop slowly, over several years, and may be so mild that you may not even notice them. Many people have no symptoms at all. Some people don't find out they have the disease until they have diabetes-related health problems, such as blurred vision or heart disease. What causes type 2 diabetes? Type 2 diabetes is caused by several factors, including being overweight and obese, not being physically active, insulin resistance, and genes. How do healthcare providers diagnose type 2 diabetes? Your healthcare provider may diagnose type 2 diabetes based on blood tests. How do I manage my type 2 diabetes? Controlling your blood glucose, blood pressure and cholesterol levels, and quitting smoking if you smoke, are important ways to manage type 2 diabetes. Lifestyle changes including planning a healthy diet, calorie restriction if you are overweight and physical activity are also part of diabetes management. So is taking any prescribed medications. Work with your healthcare team to develop a diabetes management plan that is right for you. What medications do I need to manage my type 2 diabetes? In addition to following your diabetes treatment plan, you may need diabetes medications, which may include pills or medications that you inject under your skin, such as insulin. Over time, you may need more than one diabetes medication to control your blood glucose levels. Even if you don't take insulin, you may need it at special times, such as during pregnancy or during a hospital stay.
You may also need medicine for high blood pressure, high cholesterol, or other conditions. What health problems can people with diabetes have? Following a good diabetes treatment plan can help protect against many diabetes-related health problems. However, if left untreated, diabetes can lead to problems such as heart disease and stroke, nerve damage, kidney disease, leg problems, eye disease, gum disease and other dental problems, sexual problems and bladder problems. Many people with type 2 diabetes also have non-alcoholic fatty liver disease, NAFLD. Weight loss, if you are overweight or obese, can improve NAFLD. Diabetes is also linked to other health problems such as sleep apnea, depression, some cancers, and dementia. You can take steps to reduce your chance of developing health problems related to diabetes. How can I reduce my chances of developing type 2 diabetes? Studies such as the Diabetes Prevention Program sponsored by the National Institutes of Health have shown that you can take steps to reduce your chance of developing type 2 diabetes if you have risk factors for the disease. Here are some things you can do to lower your risk. Lose weight if you are overweight and keep it off. You can prevent or delay the development of diabetes by losing 5 to 7% of your current weight. For example, if you weigh 200 pounds, your goal is to lose 10 to 14 pounds. Move more. Engage in physical activity, such as walking, for at least 30 minutes at least 5 days a week. If you haven't led an active lifestyle, talk to your doctor about what activities are best for you. Start slowly and get closer to your goal. Eat healthy foods. Eat smaller portions to reduce the number of calories you consume each day and help you lose weight. Choosing lower-fat foods is another way to reduce calories. Drink water instead of sweetened beverages. Ask your doctor what other changes you can make to prevent or delay the development of type 2 diabetes. More often than not, the best chance to prevent type 2 diabetes is to make lifestyle changes that will work for you in the long run. Start working on your action plan to prevent type 2 diabetes.